Newcomers arriving in Toronto will no longer be refused shelter space in the city system based on their immigration status, but it's likely they'll still be turned away simply because there are hardly any beds open on a daily basis.
We are always full. We are always turning people away, but it's been like that practically since the beginning when we opened in 1998.
Anne Woolger operates around 60 refugee-specific shelter beds across Toronto. In her more than 3 decades of working in refugee resettlement, she's never had a bed go unused.
What kind of troubles me is sometimes people are seeing this as a new problem, as if, oh, wow, refugees are suddenly arriving in Canada. But they've been coming for years and years. And my hope is that this might be a wake-up call right now for all levels of government.
For weeks this summer, the sidewalks outside the Peter Street Shelter Intake Office were essentially a refugee camp, as the federal and city governments argued over funding. When refugee and asylum claimants showed up, they were referred away from the main non-refugee system to federally run programs, even if a bed was free. Toronto's mayor has since stepped in to ensure that policy is no longer in effect, but the intergovernmental bickering continues.
We need an all-government approach to this issue, led by the federal government to assist us.
The head of Toronto's shelter system tells me the reality is they're struggling to house more than 3,400 newcomers in need, in addition to the city's homeless. And he stayed on message when asked. How would you respond to critics who say that refugees and asylum seekers in Toronto are being used as political pawns?
I think Toronto has stood up and done its part, right? It's city staff on the ground and our community partners that are responding to this crisis as it stands right now. Immigration in this country is a federal jurisdiction.
The issue is that if there's nowhere to go, then people are going to have to return to the streets.
Crystal Fox is a nurse practitioner at a downtown hospital. She's tried calling central intake for refugee patients to no avail.
Sometimes the direction that we've been given is that people need to camp outside of the Red Cross to try to get shelter.
Woolger believes in order for governments to resolve the crisis, it needs to be reframed.
I remember years ago when we started, when we opened 25 years ago, we could move them out within weeks because there was affordable housing. So they're not the problem.
Bolstering the urgent need to house people now, many of the newcomers have never experienced the cold of a Canadian winter before. For City News, I'm Caryn Ceolin.